Okay, well, we're back again. It's Bob Tauber here, and
Louise Jansen.
And this week we thought we'd do something a little bit different. We know that you've been reading a lot of pretty dense material on working with people with schizophrenia and other psychotic disorders in terms of diagnosis and also treatment. But it turns out that that is our population that Louise and I have worked with for the majority of our careers, our professional careers. Between the two of us, we have more than 50 years experience, primarily with clients with
severe mental illness,
with schizophrenia and other severe mental illnesses. So we thought that it would be interesting for us to just have like a brief discussion about some pearls of wisdom that we've learned over all these years in terms of working with clients. Specifically, we'll talk about clients with the symptoms of schizophrenia, because there's a long tradition in psychiatry and in other mental health schools of learning from folks who've had a lot of experience by reading their pearls of wisdom, and trying to find out what they sort of learned the hard way, not necessarily in books. So,
and if we were in a class situation, this is the kind of things that we'd be talking about, because there's certain kinds of questions when people start looking at people with these serious illnesses that they ask us. So sort of wanted to give you the benefit of having that in person, like try to replicate a little bit what we would be doing in the class.
That's true. In class, we get to share a lot of anecdotes, right?
Yeah.
In terms of what we've experienced. And so we're going to do that for you now, and then there'll be a discussion question that'll be related to what we talk about, right?
Yeah.
So these are just things that we sort of learned along the way that were maybe surprising and learned through clinical experience. So do you want me to share an anecdote? Do you want to talk about one first? Okay, well, I started working with people with schizophrenia in the early 1970s in an inpatient psychiatric hospital. And that hospital, every client who did have a psychotic disorder, they came in what's called a florid state. Their symptoms were just about as severe as you could possibly imagine. Many people were hearing critical screaming voices. They were experiencing the voices, it seemed as if coming from outside their body. They were grabbing their head. Their eyes were tracking hallucinations. They were talking back to these voices. And, one way to go about it was to try to medicate people and the symptoms out right away. But I actually discovered that there was an interpersonal way of helping people who were in that state of florid psychosis. And that was completely news to me. And what it involved was essentially kind of going up against the voices and visions and trying to compete with them for the client's relationship. Yeah, I'm trying to think of the right word. So what this involved is that a client would come in a terrible state. Sometimes I'd be in a room with just them. They're responding and seeing the visions, and I'm telling them, if Louise was a client, I'm saying, look, those voices that are screaming at you, those voices that are telling you you're no good right now, and those voices that are telling you I'm no good, they're not real, but I'm real. Touch my arm. Feel that. Is that real? Feel my arm. Okay, I'm Bob. Okay, I'm Bob and you're Louise. Those voices, see if you could touch their arm. You can't. I'm the real one.
Yeah.
So, hey, it's me. I'm the one who cares about you. Those voices don't care about you. And they're saying that you shouldn't pay attention to me. And I know they're saying things like that, but I'm the one who's the real person who could provide you with a real relationship. So
that's great.
And I do
very grounding, but also very validating.
I guess.
And very kind. Like you care enough about their person being there.
Yeah, and sometimes I would actually talk to the voices and say, I only want to talk to the voices right now. And I'd say, you leave John alone. Okay, he's had enough of this. So that's my point, is I had a relationship. It was me, the person, and the voices and visions. And so that was just an interesting thing. I don't know that you'd read about that in a book.
Right. Well, and one reason we wanted to do this is the book is good about showing the very serious symptoms that there are, but the book doesn't really capture a lot of things about working with this population and working with these folks. I mean, it captures how difficult and how serious and how severe some of those symptoms are. I think it does capture that. Maybe doesn't even capture how devastating this is to somebody and their families when this happens to them. But it really doesn't capture sort of the treatment part and really how much can be done and how much you as a professional can be doing. Just like you're saying, you have a relationship with a person. It still comes down to a relationship with the person that you can do a lot and you're with them side by side. Doesn't really capture that.
Yeah, there's one other quick follow-up. So really, I guess the learning is just how strong that relationship can be because the person is presenting in a way you wouldn't necessarily know that your relationship with them is that important. But I think you and I both had the experience when we're on State Street in Santa Barbara and we're walking. We bump into clients who we maybe didn't see for 10 years. And they maybe when they're walking on the street, there's those folks who are talking up at the sky or they're very preoccupied and they see us and it's like they come out of that psychotic state and to catch up and they ask us about how our pets are.
Yeah.
It's true, right?
Yeah, it is.
And
you know, what always amazes me too is like people that you have had difficult relationships with. I mean, like as a case manager, I was a care coordinator and worked in the clinics. Sometimes you have to be pretty directive and, you know, sometimes, I mean, I was responsible for placing lots of people in locked facilities. So I walk down the street and you think they're going to be angry about that or they're going to remember that, but they don't. What they remember is that you tried and you tried to help them. If you genuinely tried to help them, even if you had to be, you know, heavy-handed and managing things like their finances or really insisting that they take medications. If they know you tried and were genuine, that's what they remember. You know, they're in a very difficult situation, so they remember that you tried to help.
Yeah. So sometimes I think when they remember that and we bump into folks in the community as community mental health workers, we're like an anchor for them to be sort of grounded and out of that private world of visions and voices and into, you know, of feeling more safe in the community. I think we're little anchors of safety based on that relationship we earned. You know?
And we treat them, and the thing you'll find after treating people a while, as their symptoms start to abate, I mean, people have very different personalities. They have different backgrounds, they have different lifestyles, they come from all over. So there's just like a host of personalities, and they're genuinely very nice people who have very interesting lives. Excuse me. And that's how you relate to them. So a person may be from the same hometown as you. They may not be the same culture as you. They may have the same likes and dislikes. That's what you learn about them. So when you're having like these conversations with people, that's what it's based on. And genuinely very nice people, very interesting people. Some people are not nice people. That's the other thing the book doesn't really portray is that people retain their own personality. So it's like an illness that comes to them that affects them in these very dramatic symptoms, but they still are the same basic human being and personality that they grew up with. So, you know, that might be great. That might be nice. Some of the folks are like the nicest people you'd ever met. So you can be a jerk and still have mental illness.
Yeah,
you
it's
know?
true. You
and
can't.
it doesn't make you, you know, not a jerk. Sometimes people's difficult behavior, I believe, is really around just struggling and figuring out how to get through this. That you help them with coping mechanisms. They're not really as much of a jerk as you think.
So, you know, speaking of this whole jerk thing, here's another little anecdote.
My professional opinion.
No, well, I think it's the case because another thing I think I learned not early on, but after a while, was that we were, you know, I was led to believe in my readings and textbooks that the family members of people with schizophrenia were toxic for the most part. In fact, when I grew up, that was the line we were for virtually every client who had schizophrenia, so much so that when I treated them in the early programs in the early 80s, they weren't allowed to even have contact with their parents. And I think you and I, maybe we could comment on what we learned about family members of people with schizophrenia and what we learned by actually starting eventually to interact with family members is that just like there are toxic family members for people who don't have schizophrenia, the vast majority of family members of people with schizophrenia are incredibly supportive, compassionate, level-headed, kind people who've been like devastated by their kid just when they hit adolescence, having these symptoms and losing their life trajectory. But no way are they what we double binding, where they're saying stay home but leave, or their schizophrenic mother.
You have to throw all that away.
All that away.
I mean, that old learning, about how family members cause this. And the book, touches that a little bit, because you see how late in life these illnesses develop. This wasn't caused by a family dysfunctional pattern. So that you have to unlearn if you've learned that. And to know that as professionals, realize that the families in front of you have gotten that message too. So
that they caused it.
That somehow they are. This is their fault. And like when you look at somebody with this happening in their family, even us as professionals don't always know what to do. So can you imagine the family members? They have no idea what to do. When I first meet families, predominantly they are confused. They've gotten all kinds of different messages. They don't know what to do about the fact that their son is having these symptoms. They don't know for a long time what to do. They try things that don't work, and they're often very frustrated that the public isn't helping, or they're isolated about it, and they're secretive about it for good reason. But they're also sometimes very angry, and as a professional, you just have to deal with that, because they have reason to be angry. They're the ones who are stuck in this situation without understanding. It's hard enough that the client themselves don't understand. The family members and the people around them don't know what to do. So you as a professional sort of know what to do, but still struggle with it. It's a tough situation. So I guess my sense is I learned to very early on have a lot of compassion for these families, a lot of compassion for the client, but a lot also for the families who are trying to struggle with it.
Yeah, so the family members, and I could give anecdotes, but they want to be brought in.
Right.
Of course, they have to deal with all the confidentiality walls that sometimes are put up, but they want to know how their family member is doing. And I think they will give up on their family member after battling with the system for years and years and years, who just assumed they were the cause and negative. One quick thing, in the textbook it does talk about high expressed emotion families. So for sure, I think we're in agreement that families don't cause schizophrenia,
right.
But there are some family dynamics that can make it worse, particularly families that are in denial about what's the realistic limitations of their kid and what's happening with them, and family members that are still continuing to be real critical, kind of blaming the client with schizophrenia. Right. So there are some family dynamics, and there are families with people who really are toxic, but I would say 95% are
right.
not.
Right,
just like any family.
What happens generally is you're teaching the client how to handle their mental illness, you're teaching the family how to better cope and how better to handle it. So the family then can very quickly become your ally.
Yep. That buzzer you're hearing going off is just reminding us that we're kind of running out of time that we have for this segment. We're going to pick it up and do another segment. So we're going to turn this off.